So today's video is all about the receptor regulation. It is mainly the regulation of the G protein coupled receptor signaling. So initiation and the termination of the G protein receptor, that is very important. You all know the initiation of the G protein receptor, that is required for the desired response, whereas termination is also important. It is also required to protect our cell from the excessive stimulation. So today we are going to talk about the termination of the G protein receptor. So how the regulation of the G protein signaling is there. So the first step which is going to terminate this G protein signaling is with the help of RGS. So this is number one. So this is a regulator of G protein signaling. What it does, it is going to control the rate of hydrolysis of this GTP into GDP by controlling the GTPase activity of the alpha subunit. Now to make it more clear, let's review a little bit about how this G protein couple receptor, how they act. So this is the simple structure of the G protein. They are the membrane bound receptor with the transmembrane, 7 transmembrane helix. You can see 7 times 1 2 3 4 5 6 7 with the outer side where the drug can bind, and inside it is attached with the G protein. Here in the resting phase, this alpha subunit of the trimer alpha beta gamma, it bounds with the GDP, so it is inactive. Now what happens once the agonist or drug it binds with the receptor on the outside, it is going to displace this GDP with the GTP. With the also there is a conformational change. Of course conformational change will be there, which is going to cause the displacement of this GDP from here, and it is replaced with the GTP. Now this alpha GTP, it gets activated, it gets dissociated itself from this alpha and gamma subunit, and this alpha GTP, it is going to bind with the third protein, that is the effector system. It is going to cause the activation of this. Now this effector system, it can be any, it can be adenyl cyclase, it can be phospholipase C. Now depending upon which receptor, which cell, suppose here I am talking about the beta receptor. This is a beta receptor, and the beta agonistic drug, once it binds, it is going to cause the activation of this adenyl cyclase. Now once this activation of the adenyl cyclase, what it is going to cause, it is going to cause the conversion of ATP into cyclic AMP. Now this cyclic AMP, there is increase in the level of cyclic AMP. Now this cyclic AMP, it is going to cause a phosphorylation of this protein kinase. This protein kinase A, once the kinases, once they get phosphorylated, they are going to perform many action at different sites. Suppose if it is a heart, it is going to increase the cardiac activity. There will be increased cardiac activity. Now once this action happens, now what happens to this? Now alpha subunit, it has got the GTPase activity. Now what it is going to do, it is going to cause the hydrolysis of this GTP into the GDP. Once this get hydrolyzed, GTP gets hydrolyzed with the GDP, then what will happen, this beta and gamma, again it comes and get associated with the alpha subunits, and now again it is in an inactive phase, right? So G protein, it gets shuffled from off to on and again to the off. So this is the one way. Now what is the regulator of the G protein signaling? What it does, it is going to control the rate of hydrolysis of this GTP by regulating the GTPase activity of the alpha subunit. So this is the number one. Now the second one is, you can see here, this is the number one. Chalo. Now we'll go to the second one. The second one is receptor desensitization. Now how that thing happen? Again here it is a G protein. We are talking about the G protein, so I have drawn the structure of the G protein receptor. So what will happen to this receptor? So once the agonist binds with the receptor, what will happen? It is going to cause the conformational change on the insides of the receptor. This conformational change, instead of this, it also can cause the activation of GRK. Now what is this GRK? GRK is It is the G protein coupled receptor kinases. So there are many. It depends upon the tissue, it depends upon the receptor type. So they are the tissue specific, they are the receptor specific. Again here I have taken the example of beta receptor. So in the beta receptor, so these kinases, they are serine or threonine kinases. So on the beta receptor, on the inner side, on the carboxy terminus, this serine residues you can see. So what these they are going to do, they are going to cause these agonist binding, they are going to cause the activation of this kinases, and these kinases, they are going to cause the phosphorylation of this serine residue. Once this get phosphorylated, then what will happen? The beta arrestin, which was lying in the cytosol within the cell, it comes and bind with this. Once the beta arrestin, it binds with the phosphoserine residue, now it cannot couple with the G protein. Now it cannot couple with the G protein, there will be no signal transduction. So again there will be no response, no cellular response will be there. But suppose if I remove the agonist from here, if suppose there is no agonist, now what will happen? If there is no agonist there, then what will happen? There will be no activation of this kinases. If there is no activation of this, then what will happen? This phosphoserine, it gets dephosphorylated by the cellular phosphatases. If this get dephosphorylated, then what will happen? There will be removal of the beta arrestin, and again it gets, from the desensitization, it again get resensitized. This is the one mechanism. Then the second one is this beta arrestin bound receptor. It has got the property of getting fused with the plasma membrane. You can see here with the plasma membrane, it is so endocytosis of this receptor, it take place. Now once it gets inside the endosomes, what will happen? There will be removal of the agonist. Once the agonist that is removed, so this endosomes membrane, they are very much rich in the receptor phosphatases. That phosphatases, it is going to cause again dephosphorylation of this serine residue. So now from the phosphate bond, they are removed. Once this is removed, then what will happen? Again the receptor, it becomes sensitive, and there is a recycling of the receptor. Okay, so this is one. So agonist binding, activation of this, there will be desensitization, resensitization by the simple with the cellular phosphatases, but the beta arrestin bound receptor, they are prone for the endocytosis. Within the endosomes, again there is a removal, again there is a resensitization. But if there is a constant activation with the agonist, if there is a constant presence of agonist, what it does, instead of moving this way, it get fused with the lysosomes. Now within the lysosomes, the various lytic enzymes, they are there, which are going to degrade this one. And what will happen? Which is going to degrade the receptor, and there will be receptor, once it is degraded, there will be decrease in the number of receptor, or that leads to the down regulation. So this internalization and fusion with the lysosomes and further degradation, it is the main feature of mainly the tyrosine kinase linked receptor, but it is very well seen even in the beta receptor of the G protein. And now what is the clinical relevance of this? Clinical relevance, I have talked about the beta receptor. Now the short acting beta agonistic drug like salbutamol, very commonly used drug for the treatment of bronchial asthma. If you are giving it for short period, what will happen? The person is going to show the response with the brief, but what will happen after some time? There will be no cellular response will be seen with the salbutamol. Why? Because of the desensitization. But if you remove it, if you are not giving salbutamol for a long time, Then again, if you are giving after some interval, the person will show again the response. Now, why response is again shown? Because from the desensitization receptor, they have restored the sensitivity. Again, they are sensitive. Now, if you are giving salbutamol for a long period of time, there is a constant exposure of the salbutamol. आपने बहुत देर तक दिया, then what will happen? There will be again no cellular response. Patient will not show any response to the salbutamol. Because why? Because now there is a down regulation of the receptor. The receptor, they get degraded. You have to think of some other alternative of the treatment. So that's all about the regulation of the G protein signaling, especially the off mechanism. It is by RGS, that is regulator of G protein signaling, and GRKS, that is G protein receptor kinases. Now, my favorite part of the lecture, that is question answer round. So first question is action of alpha subunit of G protein is the keys binding of agonist, conversion of GDP to GTP, breakdown of GTP to GDP, and internalization of the receptor. Now binding of the agonist, if I go to this one, binding of the agonist, just see, look at this one. So structure of the G protein receptor already explained. Agonist, it binds to the outside, whereas G protein, that is totally on the other side of the membrane. So the first choice, that is wrong. Second one is conversion of GDP to GTP. So conversion of GDP to GTP, once the agonist it binds, then what happens? It is replaced by the GTP. Then this get activated. So the second choice, this is also wrong. Coming to the third one, breakdown of GTP to GDP. So once it gets activated, then it get dissociated from beta and gamma, and this whole thing alpha with the GTP, it binds with this. So it is going to activate this effector whole thing. Once this is activated, then what will happen to this alpha GTP? Alpha unit, it has got the GTP as activity. So this is going to cause a breakdown of this GTP into the GDP. So the right choice, it is this breakdown of GTP to GDP. This is the correct choice. Internalization of the receptor, that is also a wrong choice. So right choice is breakdown of GTP to GDP. Now move to the second question. Which of the following is true about G protein coupled receptor? G protein, it binds to hormone on the cell surface. अभी आपने देखा है कि it does not bind, it is totally on the other side. Then all the three subunits alpha, beta and gamma should bind to each other for the G protein to act. That is also a wrong. So because it is only the alpha subunits that is only required for the G protein to act. All the subunit, they are not required. G protein, it act as inhibitory and excitatory because of the difference in alpha subunit. Yes, this is right. So if alpha subunit, if it is bind with the GTP, it is active. If it is bound with the GDP, then it is inactive. G protein is bound to GTP in resting state. No, it is bound with the GDP. So you can see here again. So it is bound with the GDP. So alpha subunit, this is the one which is going to shuffle between active and inactive. All the three, they are not required. So correct choice, it is C. Now coming to the third question, internalization and degradation, that is feature of mainly. Here I have stress upon the mainly. Though I have shown you the example of beta receptor, but it is mainly the feature of enzymatic receptor or receptor linked with the tyrosine kinase receptor by which the insulin it acts. So if this word is there, if it is a one liner question, then you have to write this answer. But if you get this question in MCQ form, then depending on the choice, if this is given, then you have to take this one. If this is not given, beta receptor of G protein coupled receptor, then that they also show the feature of this one. Increase in the next question is increase in cyclic AMP is caused by. I've shown you in this beta receptor where the adenyl cyclase, that is the effector pathway. So with the adenyl cyclase, that is going to convert ATP into the cyclic AMP. So there is increase in cyclic AMP which is seen with the beta receptor. So right answer is beta receptor. Next is G protein coupled receptor. It is ionic receptor? No. It is metabotropic receptor. It is a kinase linked and nuclear receptor. So there are the four type of receptor mainly by which the drug act. This G protein, it belongs to the metabotropic receptor, because once this is activated, it is going to take care of many metabolic action. And there are many other different names they are also been given to this G protein, like serpentine receptor. It is then 7 transmembrane receptor, that is the other name for the G protein coupled receptor. If you, so metabotropic, that is the correct answer. So if you like this video, kindly like and subscribe my channel. So see you in the next video.